Today we hopped on the Chestnut Knoll van provided by Jodie Daniels, Assistant Director at Chestnut Knoll in Boyertown, so that we could attend the Pennsylvania Alzheimer's Disease Planning Committee event being held at the University of Pennsylvania in Philadelphia. Joining me were Celeste Fox, Montgomery County Aging and Adult Services, Linda Gambone from Community Health and Dental Care, Cass Moyer from Caring Hospice Services, and previous caregivers Donna Towers and Harry DiLorenzo. Sam, the van driver, dropped us right at the doorstep of the University of Pennsylvania where the event took place. Hello everyone, we're here at the University of Pennsylvania and we're here for a very good cause. We're going to hear all about Alzheimer's and how we're going to help those in Pennsylvania. So let's go inside and listen to this important message.
We want to show a brief video that was shared with us by the Alzheimer's Association, which tells the story and inspiration for why we're here today. Certainly tells a moving and powerful story for all of us here today.
There are thousands of people and families touched by Alzheimer's disease who are looking for answers. A room full of people learned some of those answers from doctors, caregivers, and those personally affected as they shared their information and stories relating to the disease.
We gathered together, as I said earlier, those living with the disease and their families. We gathered together those providing care and those impacted by the disease in one way or another, those conducting research. This morning we're also pleased to have with us Representative Kathy Watson, the important voice of policy. Representative Watson is chair of the Alzheimer's Caucus in Harrisburg. And I'd like to invite you to come up, Representative Watson, and share some words of welcome. Without your inspiration and leadership, I don't know if we'd be standing here today for this effort. Thank you.
Ladies and gentlemen of the committee, those of you who are here to testify, I look forward to your report because I truly believe you will be like them. You will give us a blueprint that we will be able to use. Now, I know you're going to scare me and Senator Mensch and all the others because you're going to come up with things and we go, we don't have the money, how are we going to do this? But I also know you'll be creative to find ways that we can do things that may not take government money, but we will get the job done.
So the overall big picture recommendations that came from our meeting are listed here: identify and develop novel treatments, including non-pharmacological treatments, could changing lifestyles, for example, have a big impact in delaying the onset of Alzheimer's disease, improve efficiency and knowledge gained from clinical trials. That is, take data from clinical trials that exist and mine that data to understand better why trials succeed or don't succeed.
The final slide is that early diagnosis is important for treatment and care and planning. We need to rule out or treat other medical conditions that may cause or worsen cognitive decline, avoid unnecessary additional consultations and testing, encourage lifestyle and risk factor modifications to delay or compensate for cognitive and functional decline, allow time for people to participate in legal, financial, and life planning for themselves. And another point that will get emphasized today, family caregiver education, training, counseling, and support are absolutely critical.
The combination of Parkinsonism, which is a movement disorder, and the associated cognitive problems that evolve as the brain pathology progresses over time produces actually more disability than Alzheimer's because of this combination. The unmet needs, education and support of caregivers, better drugs and disease modification, and ultimately a cure, as we all hope for. Broad-based educational programs emphasizing exercise in people with neurological disease and other lifestyle changes, particularly exercise. We know, and we're learning more and more how important this is.
Right. So in terms of what we hope to gain, first of all, is prediction who will get Alzheimer's disease. So we hope that combined with genetics, combined perhaps with biomarkers and other things, that when you go to your cardiologist, he says your cholesterol is high, take statins. When you go to your neurologist, you'll say, well, here's your genetic profile and your biomarker profile, and we hope at some point to have some.
Families, patients, they have these complex care needs, and we need to really emphasize caregiver and patient engagement, aligning the services with their changing needs. System redesign should really prioritize care continuity and collaboration among the multiple providers is essential, which is a tenet of the transitional care plan.
Frontline workers dealing with the case I gave you need to go from right now their fairly crude skills to see if someone has cognitive impairment, typically administering a very simple measure like the short particle mental status questionnaire, and their lack of skills, which they acknowledge in assessing decisional capacity, and have better skills to do those things, because that's what they're doing. And they know that, they need it, and they want it. And they are waiting for an ambitious state to train people on how to assess decisional capacity.
Is the fact that biomarkers are key to tracking the progression of brain diseases. Their development also might suggest therapies. Some biomarkers already exist in brain diseases and other areas, so it's a feasible area. I'm not talking about it'd be great to go to Neptune, right? But we're not about to go to Neptune anytime soon. And then the thing I think is also, the brain, in brain diseases, this field's kind of teenaged, There's a lot of new stuff, right? But it's old enough that you think it might work. And I think this is a great time to invest in brain You know, that's what I mean by that's where I'm putting my time and energy.
About some of the urgent care issues related to young onset dementias and frontotemporal lobar degeneration, or FTLD. FTLD comprises a heterogeneous group of clinical syndromes that involve language and social behavior and cognition, and it is common in younger patients or patients who are under the age of 65, and this poses unique caregiver challenges and healthcare problems. And dementia in a younger age group is not an uncommon phenomenon. It's estimated that up to 1 per 10,000 individuals in this age range does suffer from dementia. And in surveys of caregivers for patients of FTLD, this lack of definitive diagnosis and the delay of diagnosis is a major cause of caregiver distress.
A number of risk factors for dementia. You've heard about genes. You've heard about age is certainly one of the biggest risk factors. Those things we can't change, at least not yet. There are some conditions that increase the risk of dementia that we can potentially change. Diabetes, occurring in midlife, particularly hypertension, obesity, depression. Dr. Arnold mentioned some of these as well. Physical inactivity, I think, is very interesting. If you can look at the prevalence, by looking at the prevalence, and I don't know if this is working or not, but if you combine the prevalence of a condition with the increase in risk that it confers, you get an estimate of the attributable risk from that condition in the population. Depression may contribute as much as 15%. Physical inactivity may contribute as much as 21% based on
well, Mr. G is my father. Mr. G is Mr. Cristino Garcia, my dad. And I am a pharmacist, and I get to work with all of you, and I think we were lucky. My father passed away. He lived with Alzheimer's disease at home with us. 3 caregivers, my mom and my brother and I. He had my brother and I at a late stage. I mean, I was born when he was 60. And with resources, we were so lucky. We had wonderful physicians, neurologists, cardiologists, pharmacists that all worked together to really provide us the best care. I think resources, we found that there was a number, and I want to applaud every member in this audience and thank you for all the work that you're doing. I think the key here that I found, so I'm not representing the pharmacist story, I'm representing the caregiver. It was access. That was our issue. My father was not eligible or didn't fit the criteria for the resources that were out there available. And also, I think, what would have happened had my brother and I not been there to help my mom? She had 2 kids in college, running a business, and taking care of my dad.
We're actually communication and education. Improvement in these 2 areas would help families dealing with Alzheimer's disease. There is a lack of trained geriatricians, not only in Pennsylvania, but nationally also. This is certainly an issue of time, and the example I give is that many physicians give 6 minutes. I don't know if when you go to your physician, you get 6 minutes to see them, which is really coincidental, because 6 minutes is how long it takes my patients to walk from the room into the exam room. Families and primary caregivers need better access to resources, and there needs to be more help available for families and primary caregivers who can no longer provide care 24/7, but want to keep their loved ones with dementia home.
Dene Liott is with us, also a member of the Council on Aging. There you are. Take your time.
Good morning, everyone. Thank you for being here. And now that we've heard all of these doctors, and I don't think a lawyer, but everyone that has so much to give us, we're now down to the little old lady. It's a pleasure to be here. I'm supposed to tell you in about 5 minutes about 15 years of caregiving in home to my mother who had Alzheimer's. So I'll try to tell you just a little part of the story. When I was a youngster, my mother read the Bible daily. She was a tiny, happy, cheerful person and would play music, whistle, sing, and laugh all day long. Fortunately for both of us, Our homes were adjacent. Our bedrooms met. So all I needed to do was open a doorway so that I could take care of her. So it was when I became caregiver for 15 years. During those years, I enjoyed my time with my mother. I'm sort of upbeat on this Alzheimer's. I really and truly enjoyed her. As she became a little girl, I heard stories I had never heard before. I learned things. I tried to stay positive because it was my mother. I enjoyed that time. I cried, but I still enjoyed it. It was hard to keep positive, but I did it anyway. And I consider myself fortunate because here I am telling you this story. My mother loved to drive her car. She was always coming and going several times a day, just to be able to drive. One day she asked me if I needed anything from the store. To make her feel useful, I said, okay, bring me a quart of milk. She returned with a pound of butter. I told her I wanted the milk. She said, oh, I'll exchange it. She insisted on exchanging it. I said, okay, I'll write a note so you can give it to the clerk. That was the day I realized that something was happening to my mother's mind. It happened so gradually that neither of us realized the changes. She was more forgetful, needed things explained to her over and over. She told fibs to hide her confusion. Everything that I did for my mother was from instinct. I did not realize until much later that she was a victim of Alzheimer's disease. I started taking care of her in the early 90s. As you know, Alzheimer's disease is one step at a time. My mother and I both cried when it was necessary to take her car keys. I had to remove the connection to her stove. I locked all the doors so that she wouldn't wander. Later, she forgot how to walk, and she had to be in a wheelchair. Finally, she became confined to bed. When my mother became my baby, I changed her diapers, as she changed mine when I was her baby. And I was happy to be able to do this for her. It is important that Pennsylvanians have access to memory care campuses, as well as to be able to stay at home. We must be able to furnish a source of information for the families and caregivers, such as a toll-free telephone number, make the public aware of the services available to them for the disease. Perhaps rather than wait for the public to come to Pennsylvania Department of Aging for information, we should reach out to the public, talk to the students in high schools, colleges, ask churches, clubs, organizations to print the information in their bulletins, post flyers in public places, and make public announcements on radio and TV. Make use of every available resource to get the word out. I was fortunate because my mother's doctor suggested that I contact Aging and Adult Services for help. Celeste Fox, the supervisor for aging in Pottstown area, told me about the programs that they offered, and it was determined that my mother was eligible for the wonderful waiver program. The waiver program. The program was the waiver program. And they provided us help with the Family Caregivers Network agency, and it made it possible for me to take care of my mother at home where she wanted to be. It was my privilege and honor to care for my mother. I cherish those days, including her final hours with Chaplain Barry Moyer from Caring Hospice Services, who was there for both of us. Thank you for your attention. Be well, be happy, keep moving forward, and keep good thoughts. And a thank you to Jodie Daniels and Chestnut Knoll for bringing us here today.
top the previous speaker. I was, at an early age in high school, a caregiver for my grandmother who came to live with us, who died of Alzheimer's. And I also have a friend who is close to age, and she was recently diagnosed at Alzheimer's at the age of 61. Many studies have found that minority communities have a higher frequency of dementia, but that it is hard to prove, and the lack of education, as we heard before, also enters into that aspect.
Adults. According to a survey conducted by the Brookdale Center on Aging in New York City, it is estimated that up to 75% of LGBT older adults live alone versus 33% of elders in the general population. 90% do not have children versus 20%, and 80% have no partner versus 40%. These statistics explain why many LGBT older adults do not have the social, emotional, financial, and medical support structures that older adults in the general population enjoy. Ladies and gentlemen, we are asking that you take immediate steps to begin the process of assuring that all Pennsylvanians, no matter who they love, no matter their sexual orientation, no matter their gender identity, have equal, safe, and welcoming access to culturally competent care and services for Alzheimer's disease, dementia, and other cognitive disease states.
With the age restriction of 60 and over for Medicaid waiver and option services, we do see people younger, and most recently we had a person in our day service who was 58 years old with a 25-year-old sole caregiver who was trying to make a living. She was the only person left in the family. So you can understand the financial and the emotional issues that were on this family. Plus there was no way for her to access any support. Our transportation system here in Philadelphia does not work for people who have dementia. Our CCT program is the only subsidized alternative, and both in their vehicles as well as the way it's scheduled does not work for our families. We tend to just take a deep breath every day and put someone on the van.
Many times we see caregivers, both family and professional, put their own personal needs on the back burner in order to meet the demanding needs of their family member or client. The simple reality is there are just not enough good professional dementia caregivers to meet the growing need, and agencies like Home Helpers are having a hard time keeping the ones they have because of the high emotional toll that comes with being a caregiver. Therefore, I would like to recommend that part of the proposed plan include funding to enhance dementia training for caregivers and to develop a network of training for professional caregivers. These individuals would then become part of an ongoing peer training and peer support group, allowing them to learn from each other's experience.
In the United States, in Alzheimer's care, support, and research, our mission is to support and to fund the research, but it's also to provide and enhance care and support of all affected, both the caregiver and people with the disease. There are 2 chapters in Pennsylvania, and we basically split the population of people with Alzheimer's disease between the 2 chapters. Our programs and services include an 800 number, 800-272-3900, and last year this received 14,969 calls for help. Those calls can range from anything from where do I go to get a diagnosis to calls that we basically are keeping someone on the phone while we're getting the police to their house. We have 388 support groups attended by over 12,500 people throughout the Commonwealth. We have this year we offered 988 educational programs to over 22,512 individuals who attended it. We offer professional training both within facilities of all kinds of facilities with everyone in the continuum, as well as just in general for aides that would be working in private homes or seeking to increase their skills to get a different job. Other programs are medical alerts, safe return, care consultation, early stage, which you'll hear more about later, recreation, enrichment, all different. I also wanted to let you know that we have over 28,000 registered advocates who are immediately getting in touch with their legislators when we have legislation pending And I want to thank them because that's a large part of their activities that led us to have a plan today. There are many problems that need broad community support. One, transportation you've just heard of. I think every time I go to any health assessment, transportation is one of the first things that's mentioned. Now I want you to imagine that you're trying to get transportation for your loved one to get them to a dental appointment, and the person has dementia. It's even more difficult. We've got a ton of safety issues. All police, fire, EMT, and ambulance, and public transportation drivers need to be trained for interactions with those with Alzheimer's. And that's both for their own safety. In the case of a fireman going into a burning building, he needs to be able to know how to address and to motivate someone with a disease to go with him. They also need to know this, of course, for the safety of the person with dementia. Things like street signs, the size of the font, the height of the signs, the contrast, street and building lighting that minimizes perceptual distortion for people with Alzheimer's. This is something that each town could be doing in their own towns to make it a town that is easier for anyone aging, but especially for those with Alzheimer's. Reiterate, the supply of staff to meet the growing demands of Pennsylvanians with AD in facilities and in private homes is just amazingly large. How do we attract more workers to be professional caregivers? And that's a very difficult job, as we all know. How do we increase the capabilities? We've got to have more professional training. And we've got to have training that is updated and keeps up with the research that is being done in treatment and care. So it's important that this training be done annually. Professional training, we believe as a philosophy, our organization, that everyone from the administrator to the nurse, to the security guard, to the aide, needs to be doing this. We've got to increase our statistical reporting. BRFSS, behavioral reporting, needs to be done in Pennsylvania like it is done in 22 other states that helps us to identify who has Alzheimer's disease. Elder abuse, fraud you've heard of. Banking is something where we've got to get the banking industry able to reach out to family members and stop some of those frauds that are happening. We need to have churches, schools, businesses, and cultural settings trained to be able to handle people and groups with Alzheimer's coming through. My last request is that this plan not be a plan that's written and goes on a shelf. It has to have a renewal built into it so that it's reviewed by our legislator every 2 years, that we truly look at our progress and continue with a timeline that maps out a solution.
Words I just said, and that's early stage, because early detection matters. It is imperative that the Commonwealth of Pennsylvania's plan acknowledge the importance of increasing our community's concern and awareness about the warning signs of Alzheimer's disease. At the Alzheimer's Association, we are taking this to task through a national campaign to help educate and support concerned individuals suspecting signs in themselves or a loved one. This program enables the chapter to direct individuals in our community to their next step, whether it be their family physician or a diagnostic center. But as a community, we can't do this alone. An effective state plan should include training and education for physicians and other healthcare professionals to help them identify their early warning signs so that they can provide their patients with further diagnostic testing, education, and support for both the patient and the care partner.
My name is Carmen Torres, and it's an honor to be here today alongside so many people who are dedicated to helping the Pennsylvanians with dementia. I'm 52 years old. And I have the diagnosis of a young onset of Alzheimer's disease. I have retired from the Philadelphia Police Department after 30 years of service. And I would still be working if I didn't have this diagnosis. When I was diagnosed, I reached out to the Delaware Valley chapter of the Alzheimer's Association to get more information. And to find out what programs will help me. I am now involved in an early stage support group and serve as an early stage advisory council member. Since my diagnosis, I have learned to live in the moment. I know I'm sick, but I also know what's going on. So, I have a chance to make the most out of it. I have 2 daughters, and I'm stepping out of this for a minute. 2 daughters, and I have 3 grandchildren. So I don't mind getting dirty with them so much anymore. I know that there is no cure, but I wish to have one. I only hope that researchers will continue to try for a treatment that works and will help me and millions of others who are affected. While I wait for a cure, I sometimes worry about the future. I am fearful about what will happen when I need more help. I live alone, and even though my family is very supportive, they are young and have young families of their own. I worry about whether I'll be able to afford the care that I may need, and I worry about how I will feel when I need that care. I have been self-sufficient for a long time. So becoming dependent on others makes me sad. This diagnosis and what it means can be sobering when we all know that the story does not end here. And we all know that the story doesn't end here. I am concerned about people who do not have what I have, who live alone and are like me with Alzheimer's disease. Some have very little money and no support. Please address the issues of people who are younger with Alzheimer's, and please make certain that they can get the care that they need. There are 2 ways of looking at this. Feeling sorry for yourself and feeling sorry for yourself or being grateful. I choose to be grateful for what I have today and for the hope that I have for the future. I may not remember what happened yesterday and not be able to focus on what I am doing tomorrow, but I do believe that I have today, and today I am hopeful as the state of Pennsylvania is listening to me and to others who have Alzheimer's disease. I believe in you. Thank you so much for this opportunity.
Good afternoon, everyone, and thank you for the opportunity to have this time for the public to speak. It was an opportunity for me to realize how much caring for older adults, which I've always known as my ministry and mission in my own life, but to look at it from all the angles that it came to be in my life to this point. First, I was a student. I was a student who knew that they wanted to study healthcare, a nursing student, a student who graduated from Penn State with a degree in health planning and administration, and from Temple with a certificate in long-term care administration, and continue to be a student. And I love to learn and love the issues of aging and Alzheimer's and that sort of thing. And then I became a provider. I'm a licensed nursing home administrator in the state of Pennsylvania, and I'm a personal care home administrator. So I've worked for nonprofit organizations with multiple sites of daycares and skilled nursing facilities and assisted livings and all those sorts of things, and senior centers, and served on the boards. I've run support groups, so I've seen the emotional impact, I've seen the psychological impact. I've spent time talking to spouses who have told me things like, I needed to mourn the loss of my Gracie and learn to love this new woman. I've met with people and watched them shed tears and held their hands and spent hours with them as they mourn the loss of a 60-year-old wife, as they talk about how their teenage children can't cope with the fact that their mother, who's not even 50 years old, has Alzheimer's and their dad has to take her to daycare before he takes them to high school. So I've learned all those things and I've felt them. And I've seen the loss from the incurable disease, I've seen the splintered lives, I've seen the difficulty in navigating a system that nobody really wants to think about, frankly. So when you talk about education, there has to be a willingness to come to the education before the need is there. And it's thinking about an incurable disease is not a very palatable idea. I've seen the ambiguous loss. I've seen how we grieve, this never-ending grieving process of losing a person right before our very eyes who is still physically right there in front of us. I see the ambiguous loss of the relationships, the sadness that comes with it, the compassion fatigue, you know, the love and care and outpouring that caregivers give, but we're human beings too, and we get tired too, as professionals and as family members and the like. And so over the course of 20 years, I really thought I got it, and I knew it, and I loved it, and I always say to the staff, as employees that I've trained and supported, frontline staff and management staff, I've always said to them, you know, when things stop hurting your heart, that's when you need to go find something else to do, because this is very sad. And then I got my real education. I learned it as a daughter. And that's when I learned the real meaning of being a caregiver, being a provider, the challenges, and what they feel right in your heart. See, I was lucky enough to be adopted from the foster care system, from the child welfare system in the state of Pennsylvania at the age of 8. And so I was adopted by the most lovely Pennsylvania Dutch farming couple that you could ever meet. And through caring for my mother, who developed Alzheimer's over the course of 10 years, I learned what it meant to be the sandwich generation. I learned what it meant to try and have my 4-year-old son at daycare and know if my mom took her pills. I learned what it meant to say, to take meals. I learned what it meant to watch her go. I learned what it meant to feel it. Because you know what I learned the most? I learned that you can't intellectualize your way through the feelings. I learned you can't read a book and quite know how it feels as it does when you're living the experience. So thank you for taking this opportunity today. It affects all of us. I believe there are many organizations, community, churches, civic, that will help the government in achieving these goals. And I appreciate the opportunity to speak from these varied facets of how it's been an experience in my life. And I'd like to commend the prior speaker because that took a lot of courage.
Therefore, the educational program that I envision must also include how caregivers can monitor their own behavior in order to self-identify when they are, in fact, becoming a risk factor for abuse, neglect, or exploitation. President John F. Kennedy told us years ago that, quote, "a society's quality and durability can best be measured by the respect and care given its elder citizens." Simply stated, we need to do more to prevent the victimization of some of our frailest members of our society and to eradicate elder abuse in order to fulfill this mandate.
And the use of multiple medications can lead to inappropriate use, non-adherence, increasing cost burdens, even if they have insurance, and a higher risk of adverse effects, weight loss, falls, decline in functional and cognitive status. Such adverse drug events affect an estimated 5 to 35% of older adults living in the community per year and are responsible for approximately 10% of hospital admissions. We need to embrace the idea of integrated care team, one in which pharmacists are embedded in practices or medical homes. Provide a scenario where no patient or caregiver ever leaves a care center without the full time and attention necessary to explain how to properly use their medications. I realize the pie is getting smaller. Physicians are not going to want to share in their shrinking reimbursement. And I completely understand that. But as a pharmacist, if we could save $200 billion in unnecessary medical care because of proper prescription management, I think that's a first step in the right direction.
helpful. I think we need to do more to remove the stigma from dementia. You are given a diagnosis of dementia and you are labeled. And from the moment that you're given that diagnosis, you are considered incompetent. And you are watched like a hawk. And that's not fair. Having been a speaker for the Alzheimer's Association, and the daughter that's taking care of her mother, and the daughter that says, my mother changes her dresses 10 times a day. And I say, does your mother need help changing her dresses? No. Does your mother mess up her closet changing her dresses? No. And you have to say, then count your blessings because she's very happy. And you don't have to stop what you're doing to help her change that. We have to help people find the positive. And we need public education to get rid of that stigma.
During the time my mom and I were caregiving, and unfortunately a year ago, I lost my mom and her life was cut shorter. I truly believe from the impact it had on her heart and high blood pressure as she was caring for my dad. Perhaps she would have been here longer if there would have been more adult daycare facilities. We had to go on a waiting list, and then it wasn't really geared towards the dementia that my father was going through. As we could no longer care for him, we moved him to assisted living, and unfortunately, at that time, and I'm hoping that it's progressing, but I know that we could still have some more emphasis in this area, is there's the general population for assisted living, and then there's the dementia unit. I truly believe there needs to be more levels of the dementia unit. My father was still a social person and was still functioning somewhat. He enjoyed the interaction with people, and when I would visit him, he would say they just sleep. They're zombies. He would actually use that word, zombies, and he didn't have that interaction that we really do need.
Additional attention based on my experience is the lack of home and community-based options for people living with Alzheimer's disease or related disorders. If an individual's needs can be safely and costly effectively met in the community, then we should do everything possible to assist the individual and their family to access these services. Making the right service choice at the right time for the individual and family support is the key, whether it is home with support, day and or respite care, personal care, or skilled nursing. There is a growing need for home health and or home care and other services such as housekeeping, transportation, and safety assessments.
The first time you hear it in a favorite restaurant, I've not been here before. Or as you sit quietly in your living room that you've had for 25 years, I want to go home. It's a shock to your system, even if you're expecting it, and so begins the long, long goodbye. Having met my wife 31 years ago on a disco dance floor, she was the original cougar. We were a bit of an unusual couple. She was 41, and I had just turned 24 that day. She had 2 great kids, and my baby was an alarm company that I had started at the age of 20. Ginny was always the one with the big grin and the vivacious personality. But in her 60s, what started out as uncharacteristic hostility soon morphed into me double-checking my facts and writing down many of the unbelievable statements that Ginny was making. Over a couple of years, it became painfully apparent we had a serious mental health issue on our hands. Eventually, we found our way right here, University of Pennsylvania. And I'm glad to say that I met Dr. Branch Coslett. He and his team worked up an assessment of Ginny and her condition, and it was true. She had progressive dementia, and it probably wasn't reversible. We went from part-time people checking in on her to full-time live-ins to where now Ginny resides in a great county-run nursing home in Chamonix Manor in Bucks County.
4 years ago, as she walked in as a wander risk, she's now immobile, and she's in the final stages of her condition. Years of experience, first as a truth seeker, then as a reality absorber, and finally as a heavy-duty caregiver, has given me a number of insights. In some ways, I feel lucky. I was young enough to have the energy to care for her, and at the same time advocate for her. Others are not so lucky. It's easy to get worn out. Many do not want to utter the D word. In fact, in many ways, the C word has now been replaced with the D word. We hear similar fears of the unknown, similar taboos and stigmas, often wishful thinking without taking any action. But moreover, there's a general lack of knowledge, including detecting early warning signs, taking preventative measures, knowing how to be an advocate for yourself and others, and knowing how to handle those awkward moments in private and particularly in public. People working in retail, banking, hospitality, telemarketing, and even healthcare are generally not trained in the subtle, if even self-evident, issues they face when dealing with the person. And in fact, unlike the American with Disabilities Act, which mandates the more obvious need for wheelchair ramps and those with hearing and sight impaired accessibility, in the early stages, those with the dementia often look fine walking in or sound normal to somebody when they pick up the phone, and it confuses many of those that interact with dementia sufferers and their caregivers. I decided to take Ginny's negative, turn it into a positive, with the establishment of the Dementia Society. This will be an umbrella organization that looks to broadly educate everyone regarding all various forms of dementia. Our number one mission is to provide never-ending caregiver recognition and critically important counseling. I had it, it helps. And number two, to provide dementia awareness training at no cost or low cost to frontline workers, managers, senior executives, and communities at large.
And I would like to commend to you the notion that getting rid of the stigma of dementia involves getting rid of the word dementia, because the word dementia itself is a very toxic word. I had the experience of having that reference made to my wife once at Bryn Mawr Rehab, where she was undergoing some sort of rehabilitation procedure. And I had this sudden epiphany. The epiphany was that this is a dreadful word. And it inspired me to spend about the next year and a half writing and co-authoring with Dr. John Frozinowski an article that was published in the Archives of Neurology. And the title of the article is Dementia, a Word to be Forgotten. And I would tell you that the entire, one year before we published this article, which I did not know, the entire country of Japan eliminated the word dementia from all public use and all public documents. They appointed a committee, national committee, to have focus groups and work with the idea and come up with a substitute word. And in the Japanese language, it just simply required a slight change in the exact word. What we have suggested, what we have suggested as an alternative is neurocognitive disorder.
But for too long, dementia was thought to be an inevitable result of aging. Now we know it's a disease. It has a cause, which means it can be cured. The point I want to make is that it's also not simply a disease of the aged. It affects people under the age of 65. And the one plea to the planning committee I want to make, I know Mr. Ellenbogen can attest to this quite well as well, but please be sure that you include in your plan an easy mechanism for people under the age of retirement to access the services they need.
Now exported to Penn as well, called the Behavioral Health Lab, which is really a model of collaborative care for psychiatric illness, including dementia care, where there's a behavioral health specialist under the supervision of a psychiatrist who works with a primary care provider to kind of optimize the psychiatric care that's delivered to patients with cognitive deficits. And it's really a way of giving access to care with patients who are otherwise unable to get specialty care. This can be done by telephone, it can be done by video conferencing, and that's another program that's ongoing at the VA. For instance, we're using it at our Parkinson Center there, is video conferencing for the provision of actual neurological care for Parkinson's disease. And I've had the opportunity to participate in that video care as a psychiatrist, so I can see people remotely, do my assessments, and actually follow up and prescribe medication, for instance, from quite a distance. So these are some of the programs that I think are needed in a state like Pennsylvania, where there's large rural areas and people have difficulty accessing specialty care.
It is my pleasure to introduce Senator Bob Mensch.
Dene, good afternoon. How are you?
I'm fine. Why are you here today, Senator?
Well, you and I are here for a Alzheimer's task force meeting. I'm being a member of the legislature and chairing Aging and Youth Committee in the Senate. I'm a standing member of the committee you were here to present today. We're going around the state trying to discover information, additional information, about how the state can assist with the continuing issues surrounding the growth of Alzheimer's disease.
You know, and I know that I know your mother.
Yes.
And, you know, my mother had Alzheimer's, and I know your mother's up in ages. And how is she doing?
Mother will be 93 in December, and her mental faculties are still very sharp. Her husband, my dad, had some difficulties in the later stage of his life with Alzheimer's.
Oh, but then your mother's fine. Well, good for her.
Great. Yeah, absolutely.
I love it. And I'm so happy for everything that you do for us in the aging population.
Well, thank you. You know, it's what I've come to understand is as you get older, you appreciate more the need for aging services. So I'm aging, and so I appreciate all the more the good work that we do from the state. It's never enough, but you have to pick your battles and do those things that you can have the greatest effect for the largest part of the population.
And we are that large portion in Pennsylvania.
Pennsylvania is still the fourth largest seniors population in the nation by percent of population. And in Pennsylvania itself, the aging demographic is 28%, I believe, is the right number. So
I'm glad to be among that. I hope to continue to be here.
Well, don't we all? Sure, we want that number to expand and increase, and we want to keep contributing to that expansion, surely.
And we want to keep you in the state of Pennsylvania. You keep moving there, Bob.
You know, age is the matter of mind. If you don't mind, it doesn't matter. So, yeah, we keep on moving. We're having a lot of fun.
And we want to keep you in the Senate.
Well, thank you very much. I'd like to stay there.
We want you there. And we need Bob there. Don't forget that. Thank you very much, Senator Mensch.
Dene, thank you. As always, I look forward to the next time we can sit down and do a full show.
That'll be great. Very soon.
Yes, it's on the calendar.
Yeah, I think so. It is my pleasure to introduce the Secretary of Aging, Brian Duke.
It's a pleasure to be with you, Dean.
And what happened here today?
Today there was a regional meeting of the Pennsylvania Alzheimer's Disease Committee. This committee was appointed by Governor Tom Corbett by executive order, following inspiration from our legislator, especially Representative Kathy Watson and others, to talk about Alzheimer's disease and its impact on Pennsylvanians.
And about how many people contributed today?
You know, we had about 35 speakers today, and they were from a wide spectrum. We had researchers, we had policy people, we had healthcare providers, we had a person living with the disease, and we had their family members. And I think all the information today will be very helpful to the committee. We're traveling the state. We have 6 regional meetings. This was the 4th one, and we'll be gathering that information along with other research to help form recommendations for Governor Corbett.
And we are going to have a lot of work to do because there's a lot to read.
Well, there's a lot to read, but it also, you know, we have to think about how many of our fellow citizens are faced with the disease. About 400,000 Pennsylvanians either have Alzheimer's or related dementia. So there's a lot of work for the committee and an important work for the committee to continue so that we have a good report in February.
And I'm sure, Secretary, that you'll be able to handle this from the Department of Aging.
Oh, thank you. Well, I count on a good team I have at the Department of Aging and people like yourself on the Pennsylvania Council on Aging and many others.
Thank you so much, and it's so wonderful the governor did this.
Thank you. Yeah, we thank Governor Corbett a lot. Thank you.
Thank you. And this is the end of a perfect day. We are ready to hop the van from Chestnut, Knoll. Thank you so much for joining us. Come aboard. want to thank Chestnut Knoll, that does so much for the caregiving community, for making it possible to share this event with you.